The diagnosis of ischemic stroke is done through brain scans using CT and MRI scans, and sometimes EEG and ultrasound scans. There are two main treatments for ischemic stroke. First one is thrombolysis and second one is thrombectomy. A medicine is used to break the clot in order to clear the blockage. The medicine is beneficial as early as after the onset of stroke symptoms, around first 4.5 hours. But unfortunately, it is not suitable for all the ischemic stroke patients. They are not suitable if the stroke is mild or if there is bleeding in the brain. They had a recent brain surgery or they are using certain medications that can cause bleeding to make the matter worse. Unfortunately, stroke sufferers who are suitable for thrombectomy remain at risk of bleeding up to 40 days after getting the treatment. And 1 in 40 cases, it can be fatal. Let's move on to hemorrhagic stroke. There are two types of hemorrhagic strokes. SAH, subarachnoid hemorrhage. In this type, the bleeding occurs on the surface of the brain, whereas in ICH, that is intracerebral hemorrhage, the bleeding takes place within the brain. In the SAH, subarachnoid hemorrhage, blood leaks out of a blood vessel on the surface of the brain and gets into the subarachnoid space, that is protective layer of fluid surrounding the brain. This is least common type of stroke, and 1 in 20 strokes is SAH stroke. The main cause of SAH is aneurysm. An aneurysm is a blood vessel that has ballooned out. Because the walls of an aneurysm are weak, there is a possibility that it can burst with the pressure of the blood.